need to be taken in daily. Dear friends, the idea is the more people take foods from various food groups, the more likely they are to meet their nutrient requirements and therefore boost their immune system to prevent and fight diseases including COVID-19. Going by the statistics we have been providing, we also note that more males than females have been infected with COVID-19 in our country and also in other countries. While the reason for this is not clear yet, probably men may need to reevaluate their dietary habits and lifestyles by consuming healthy diets, including vegetables and fruits daily. Fruits and vegetables are important in boosting immunity and contribute to disease prevention and healing. It is recommended that we vary or alternate the types of fruits and vegetables. Red and yellow vegetables and fruits such as pumpkins, mangoes and carrots are a rich source of vitamin A, which is an antioxidant. On the other hand, green leafy vegetables such as amaranth or terere, African nightshade or managu, and spider plant or sageti are rich in vitamins and iron too. Other vegetables and fruits such as sweet pepper, tomatoes, onions, bananas, pineapples are a good source of various vitamins and minerals. Let us take advantage of the fruits and vegetables, particularly during this season, now that they are available. Other antioxidants that are important in boosting immunity include, for example, vitamin E. The major dietary sources of vitamin E include vegetable and fish oils, nuts, seeds, spinach, and broccoli. Another beneficial vitamin is vitamin D, which reduces the risks of several non-communicable diseases such as cancer, cardiovascular disease, diabetes mellitus, and hypertension. Non-communicable diseases significantly increase the risk of death from respiratory tract infections such as COVID-19. And a good source of vitamin D is sunlight, which our country, being in the tropics, is blessed with all year round. So please spend some time outdoors each day to soak in sunlight and generate the vitamin D that your body requires. Foods containing vitamin D include fish, liver, egg yolk, and foods that are fortified with vitamin D. Ladies and gentlemen, I urge all of us to adopt healthy lifestyles by reducing consumption of highly refined, processed foods, sweets, sugar-sweetened and flavored drinks or beverages, which all have high amounts of unhealthy fats, sugar, and salt. 2, avoiding smoking and consumption of alcohol. And 3, engaging in regular physical activity. Moderate intensity exercise has immune boosting benefits that helps our bodies fight infections, including COVID-19. Adults should aim at 30 to 60 minutes of physical activity for at least 5 days every week. I have noted the many questions in social media inquiring on nutrition management of COVID-19 symptoms. Mild symptoms including coughing, lack of appetite, early satiety, and fatigue can be managed by taking warm fluids regularly throughout the day. It can also be managed by eating small, frequent meals rich in nutrients, eating preferred nutritious meals or snacks, increasing the intake of fruits, seeds, and nuts, in addition to a healthy diet. However, if one is undernourished, overweight, or obese, or unable to eat as a result of disease, its symptoms or other existing comorbidities, they are advised to seek health care from a healthcare provider for more specialized and individualized nutrition and dietetics care. We have spent quite a bit of time talking about diet and the need for a healthy diet, and that is because of its importance and one of the ways in which we can defend ourselves against any infection is to ensure that we are eating right and eating the right food. Let me move now to today's update on COVID-19 statistics. Today we report 788 people who have tested positive following the testing of 5,521 samples. This now brings the number of positive cases to 200 and this brings the number of positive cases pushing our cumulative tests to 295,280. That's the number of cumulative tests we have conducted so far. Amongst these 788 cases of today, 785 are Kenyans, while 3 are foreigners. 475 are male, 313 are female. The youngest is 1 year old, while the oldest is 89 years old. The counties that have registered the largest number of positives, led by Nairobi County with 487 cases, Kiambu 86, Nakuru 34, Kajiado 26, Mombasa 25, Machakos 21, Busia 20, Narok 14, Bomet 9, and several other counties in single digit, which you'll find in the brief when you receive it. The cases in terms of sub-counties are distributed as follows, and I will read out for the first 2 or 3 counties that recorded the largest numbers. Nairobi, with 487 cases, had 58 cases in Langata, 50 in Westlands, 42 in Dagoretti North, 39 in Embakasi East, 34 in Makadara, 32 Embakasi South, 32 Starehe, 30 in West Embakasi West, 29 Roysambu, 28 in Kasarani, 19 in Ruaraka, 19 in Kibra, 19 in Dagoretti South, 18 in Embakasi North, 14 in Embakasi Central, 14 in Kamkunji, and 10 in Mathare. Kiambu's 86 cases came from Thika, 19, Ruiru 13, Kiambaa 13, Kiambu Town 10, Kikuyu 8, Juja 7, Lari, Limuru, and Kabete 4 cases each, Gatundu North and Githunguri 2 cases each. Nakuru's 34 cases come from Naivasha, 21, Nakuru West 12, and Nakuru East 1. I think the rest I will allow you to read it from the document once we present it to you. On a positive note, 100 patients have recovered from the disease. From this number, 8 are from the home-based care program, and 92 have been discharged from various health facilities, bringing the total number of recoveries to 8,121. And again, we want to take this opportunity to thank our healthcare workers for the great work they're doing out there. At the same time, and unfortunately, we report also the loss of 14 Kenyans who have succumbed to this disease, bringing the total number of fatalities to 235. And we want to take this opportunity to send our deep-felt condolences to the families and friends of those who have lost their loved ones over the last 24 hours and over the course of this pandemic in the country. I'll stop there, and I want to thank you. And I want to now invite C.S. Macharia to make a statement that he wishes to share. CS Macharia.
Thank you very much, CS. I'm here to give an update on the transportation sector. Like you recall, we said before, this is a very, very key sector, both in terms of transmission of the virus, but also in terms of now opening up the economy. And so we thought it's important to update Kenyans as to where we are with regard to this particular key sector. I think you recall there were 3 areas we looked at before. The first one was the overland transport in terms of buses, which, if you recall, we managed to open up around the 6th of July this year. Then there was the issue about domestic flights, which, after getting approvals by the president and after doing the necessary protocols, we managed to open up the domestic flights on the 15th of this month of July. And then there was Madaraka Express, which, as you recall, connects Nairobi to Mombasa. And this was reopened on the 20th of July this year. So what has been remaining until now has been the international flights, which many of us Kenyans, many of the international visitors have been looking forward to this. You recall when the president did announce, he did say that domestic flights will be reopened on the 15th of July, but the international flights would wait until the 1st of August, which is 2 days from now. We decided to start with the domestic flights to give ourselves some learning curve so that we learn what needs to be done, what needs to be improved to make sure that when we go for international flights, we shall be indeed very ready to do so. And so today I would like to read a communique specifically targeting the international flights. This communique is on the resumption of international air travel on 1st of August 2020. His Excellency the President of the Republic of Kenya directed that international air travel would resume on the 1st of August 2020 and instructed the Ministry of Transport, Infrastructure, Housing, Urban Development and Public Works to develop a protocol to ensure the safety of the travelers. I would like to report that this protocol was completed by a multi-agency team and duly approved ultimately by the CS of Health on the 14th of July. The ministry, in consultation with relevant stakeholders, prepared a protocol for air travel operations during COVID-19 public health crisis. The protocol seeks to provide guidelines to ensure that air travel remains safe during the pandemic for both domestic and international flights. The protocol recognizes that the adverse impacts of the COVID-19 pandemic have been experienced in most sectors of the economy, and the aviation industry is amongst the most impacted. The protocol has therefore confirmed as follows. 1, all arriving passengers on international flights with a PCR-based COVID-19 negative certificate whose body temperature is not above 37.5 degrees Celsius and do not have a persistent cough, difficulty in breathing, or other flu-like symptoms, and have been tested 96 hours before travel shall be exempt from quarantine. Let me say this is not a blanket approval, and so we do have initially a list of countries from which passengers will be allowed. This will be a list which will be reviewed on an ongoing basis, because you know this issue about COVID is not static. It gets better, it gets worse. So whereas we have an initial list here, by tomorrow we shall review that list, depending on circumstances on the ground when we do the global mapping of the threat and intensity of the coronavirus. But for a start, these countries which I'm going to mention here will be the initial list from which we shall be allowing passengers to come from. 1, China, South Korea, Japan, Canada, Zimbabwe, Ethiopia, Switzerland, Rwanda, Uganda, Namibia, and Morocco. These countries are the countries with mild or limited community transmission. All they have declining incidences. And these are the ones initially we shall be allowing passengers to come from. In terms of the protocol, number 2 of what we are going to highlight, for those passengers traveling out of the country, meaning you and me, they'll be required to abide by the particular travel, health, and COVID-19 related requirements of the destination country. So before you travel, make sure that you know where you're going, what that country expects. We also like to put some heavy responsibility on the airlines. Before you board your passengers, just like you check on the visa requirements, just make sure that your passengers comply with the requirements of where they are going. Number 3, passengers arriving on flights after the curfew with a valid air ticket and boarding pass shall be allowed to proceed to their hotels or residences. Number 4, drivers of those passengers should have evidence that they came from the airport to drop or pick up passengers. Number 5, passengers departing on flights after curfew and with a valid air ticket and boarding pass shall be allowed to proceed to their destination or their departure airport. 6, air operators shall provide guidance material to passengers regarding application of the preventive measures on board. Number 7, where physical distancing cannot be guaranteed because of the seat configuration or other operational constraints, the crew members will make constant on-board announcements reminding passengers to adhere at all times to all the other preventive measures, including strict hand hygiene and respiratory etiquette, and should wear surgical face masks. In addition, and in such cases, other measures such as cabin recirculation, air filters will be in place. 8, and last, working jointly with Airports Authority and Kenya Civil Aviation, the Ministry of Transport, Infrastructure, Housing, Urban Development, and Public Works is reviewing frequency and timing of flights to facilitate physical distancing at the airport. You know, before COVID, some of the airlines used to have like 7 flights per week. Others up to actually 24, because they used to have like 3 flights per day. Now, as you know, there's COVID, and so there was an issue whether we should reduce this frequency of those flights. But what we know is that initially the numbers of people traveling will be quite low. So we shall be reviewing in the first week to see how many flights are getting to Nairobi or Mombasa or Kisumu or Eldoret, and then we shall take the appropriate measures. Before I conclude, let me say, these measures we are taking today, or these announcements we are making today, in terms of opening up the international airspace, it should have huge positive impact in terms of tourism. You are aware tourism employs at least 1.6 million Kenyans. And so we believe this is timely in terms of opening up the economy. Secondly, you know, Nairobi is an investment hub, not just for East Africa, but the entire region. And so we shall have investors, we shall have business people now having to travel to Nairobi to be able to do their business. And of course, trade. You are aware, like Kenya Airways, although they don't have many freighters, you know, planes which carry cargo, they do carry a lot of cargo in the passenger flights. In the belly of, for example, the 787 aircraft, they can carry up to 40 tons of fresh produce. So by opening up the airspace, we should see not just the passenger travel benefiting, but also in terms of cargo, which will bring more business and more employment to our country. We never stopped cargo flights, so what we are doing now is to augment what we've done before. And so we expect going forward, subject to certain conditions, subject to airlines following the protocols required, we expect to see a positive impact in terms of the economic development of our country. Thank you very much.
Thank you very much, Waziri. I think we will now allow the media to pause, and I would want to request kindly, because of time constraint, that we restrain ourselves to at least just 3 questions that are directed to the statement that CS Macharia has made or the one from the Ministry of Health. 3 questions, please. So.
Hi, my name is Graham Kajilo from The Standard. My question is on the issue of the 96 hours testing. You said that these people will not be put on quarantine. So does it mean if someone else comes out of that window, they'll have to be put on quarantine? And also I would like a response on the recommendations that were made by the WHO in terms of improving the care and response of COVID-19.
My name is David Mudhoka from TV47. I have 2 questions. The first one regards one of the measures set to combat the spread of COVID-19, and that is masks. With the government now requiring almost every Kenyan to put on masks in public places, we have seen growth in varieties of masks, some of which the ability now to contain, or rather to keep the virus at bay, remains questionable. What is the ministry's comment on even masks made of cloth, made of cotton, made of sponge in combating COVID-19? Then the second question is about home-based care. How many people now do we have on home-based care? And how many people even are in our hospitals receiving treatment? And what is the condition? What is the state of our isolation centers?
Helen Aura from NTV. This is to the ministry. Do we have accountability as to how the COVID funds are being utilized, considering the fact that one top government official has raised an alarm on how to handle the matter and how the funds are being used? And are we slacking on contact tracing thus far? This two questions for the Ministry of Transport. We've reopened international travel, but right now we still see that the public transport sector within the country, they're blatantly disregarding the laws which are there. And we see the transport sector, the matatus are carrying passengers in excess. What are we doing about it? And you said for those arriving past curfew hours, you have to have a document showing that for you to be allowed in due past curfew. So is this going to be a special document issued by the government, or are you just going to show the during the roadblocks, will you just show your travel passes, considering that you've come into the country? Kindly expound on that.
Okay, so there are two questions for you, Waziri. I think the first one and the last one,
Yes.
so I'll allow you to respond to that.
Okay, let me start with the first one, where I think the gentleman asked about if somebody takes the test before the 96 hours, what will happen when they get here? Will they be quarantined or not? I think the answer to that is that they'll not be allowed to travel in the first place, because by the time you board, the requirement is very clear. You have to show the COVID-free certificate done through the PCR testing process, and whoever is allowing you to board must check when that test was done. If it was done before the 96 hours, then of course you'll not be allowed to board. And therefore, the question of quarantine here will not arise. Let me also answer the last one, which was asked about the public transport by NTV. Yes, obviously this is a matter of concern, and that's why we have asked the law enforcement agencies to do what they can to make sure that those breaking the law or breaking the requirements which have been put in place, they are put in the right place. So this is a matter which we are taking very seriously. I know in terms of the numbers which these buses are supposed to carry, it's very clear. We have engaged the stakeholders. They know what is required. For example, they know you have to have a certificate which is co-signed by the Ministry of Health, but also with the county commissioner himself. And so that certification has to continue. And during the checkups, during roadblocks, we shall be checking through the law enforcement agencies that indeed those public buses are not breaking the law. The issue about curfew, what document? I think we did say that they do not require a special document, whether you're flying out or flying in. If you're flying in or flying out, you must have either a ticket or a boarding pass. Nobody flies without any of those two. And so those two will suffice. We're not required to get additional document to prove you're flying in or you're flying out. The boarding pass or the air ticket will suffice. Thank you.
Thank you, Waziri. A question on masks and the different types of masks. Indeed, yes, there are many different types of masks, and you find people even amongst us here wearing different types of masks. And each of these masks has a role in terms of when it should be used. The most and best effective mask is called the N95 mask, or the high particulate mask. That is a mask that has a very high level of restricting anything getting through or getting out. And that one is reserved primarily for circumstances where there is very, very close high-risk areas, for example, frontline healthcare workers working, attending to patients who are either in ICU or in the wards who are COVID positive. Those are the types of masks you use in those circumstances, the N95. When We put out the regulation that we require people to wear masks in the public. The surgical mask, which is these blue ones we're working, are well and fine. They are also fairly cheap and affordable. And they can protect one from inhaling any of those particles. But masks should not be seen in isolation. Wearing a mask alone is not sufficient to protect you. Coupling wearing of the mask with maintaining the distance is the key thing. So if you're wearing a mask, even sometimes the N95, and you are very, very close to a person who is shedding the virus for long periods of time, there is a chance that you could get infected. So wearing a mask must be seen in the light of the physical and social distancing. The cloth masks that are widely used are fairly good. They can do a good job provided the distancing is adhered to. And you stay away at least 1.5 meters to 2 meters away from your colleague. You minimize the time of close contact that you have. They are fairly safe. And I think the DG will also add to that. The second question is the DG who will respond to on home-based care. And then you had two other questions from Helen, NTV. Utilization of COVID funds. I think I can't respond to that any more than simply say that government systems have a way of monitoring utilization of funds. We have several oversight bodies that are responsible for monitoring the use of those funds. And I do not know the report that you refer to. I haven't seen that article, but I think we will leave it to the proper agencies to answer that question and pose that question if they so feel that there is a need to do so. Regarding contact tracing, I think the DG will have one or two things to say on that as well. DG, I push it. Hand over to you.
Thank you, CS Mashario, CS Kasha, CS Dr. Rashid. I would start with additional information on the masks. I think we have standards for the surgical masks that are developed through various agencies internationally. But now that the cloth masks are also in fashion, we are working with Kenya Bureau of Standards to ensure that we have at least a semblance of standard, even if it is for our own local use. In terms of home-based care, basically home-based care is taking care of a sick person who is relatively stable in a home environment under the supervision of a trained healthcare worker. And this is a platform that we have used previously. As at to date, we have released more than 3,500 people who have undergone home-based care for COVID-19. And thus far, we have not registered any death of any case from home-based care. This is because of the stringent parameters that we put in place following customization of the guidelines that we received from WHO. And because home-based care is 9 times cheaper than institutional care, we will still continue to espouse this platform for management of COVID-19. More so because close to 90% of our cases are symptomatic and therefore don't require institutional care. So home-based care will continue to be a platform that we really focus on. I know we'll have challenges in terms of reporting because home-based care therefore means reporting has to come at the household level, and for the community health volunteers to move from household to household to collect this information, bring it to the facility before it is collected at the county health management team level, before bringing it to our level, then we'll be able to take time. But because of the additional savings that will accrue from home-based care, it is a platform that will continue to espouse, not only through community health volunteers, but also individual members of the household. Because if the cases surge beyond a certain capacity, especially in counties which don't have well-established community health units, then it will be up to the individual members of the household to be able to support the home-based care program for relatives and friends who are affected. In terms of contact tracing, yes, the pandemic, as it were in Kenya now, counties at various stages of the pandemic, which is normally divided into 4 phases, like Nairobi is in phase 3, phase 4, where we have widespread community transmission. When you have widespread community transmission, it's very difficult to link a case to a contact. And because contact tracing is such an intensive process that requires a lot of resources, then you need to shift your focus, probably to ensuring that pockets of a particular place which have not reported cases, that pocket is protected from getting infections, and also shielding the vulnerable. That is those who are over 60 years and those with coexisting medical conditions. But counties which are just reporting a few cases, like Baringo, which reported their first case yesterday, or counties like Mombasa, where infections are plateauing or the cases are going down, then it makes business sense to invest more in contact tracing. But well-established community transmission, contact tracing becomes a very, very difficult task and may not yield much. But that notwithstanding, you still don't give up on it altogether. You continue to try and map cases with contacts. Where you cannot be able to match, then you go to trying to shield areas which have not reported cases and shielding the vulnerable. Remember, when he started contact tracing, we could even trace up to 4th generation. Like Kilifi, we had the primary person, the secondary contact, the tertiary contacts who are contacts of the secondary contact, and then the quaternary contacts who are contacts of the tertiary contact. That is not practical to be able to do in Nairobi as the disease evolves. In terms of the number of cases, today we have 1,275 Kenyans admitted in various hospitals throughout the Republic. Out of these, 56 are in ICU setting. 34 are on ventilatory support, meaning that machine is breathing on their behalf because they have a serious COVID infection and their lungs are not functioning optimally. And then 20 are on supplemental oxygen support, meaning they are in ICU, but with additional oxygen we give them, they can be able to maintain their saturation and provide enough oxygen for their bodies to function optimally. 2 are on observation in ICU, meaning they have come from the very critical to oxygen supplementation, but basically we are just observing them to see whether they can now move from ICU to HDU and the ordinary ward. Of note, of course, is what was really reported, 14 deaths. For the first time since we started reporting mortalities, today we have reported 9 people who have died without coexisting comorbidities. And only 5 had coexisting comorbidities like hypertension, diabetes. So this tells us that the disease is assuming a different kind of effect on our population. And this is more the reason that we need to take these measures very, very seriously. These people who are dying without comorbidities are younger people in their very productive age group, and that is why we continue to appeal to the youth to ensure that they take these measures that we continue to articulate very, very seriously, especially physical distancing and avoiding congregating, ensuring that they wash their hands, and of course proper use of the masks. These numbers are likely to increase as we head towards our peak, which could be anywhere between late August, September to October. We are still doing the projections again based on the mobility pattern and also the kind of cases that we see on a day-to-day basis, and we'll be able to share this information with you going forward. I thank you.
nilibidi na 455.
470.
Ni 438.
438 was the number.
Yeah.
Kwanza ulikuwa umeweka namba gani?
583.
583.
968.
Swali ni lowest unique bid ya kwako ni gani?
Kenyans are picking up great brands for a few shillings. Take home a brand new Yamaha Crux Rev B for only a few shillings. Simply place your lowest unique bid now. Go to howlow.co.ke